Hello and welcome to today's Consortium of Universities for Global Health webinar on reforming the World Health Organization, how we can strengthen the world's leading public health agency. I'm Dr. Keith Martin, the Executive Director of CUGH here in Washington, D.C. The COVID-19 pandemic and all its tragedy shone a stark light on what works and what does not work in terms of our public health response to a transnational challenge. It showed also a pathway of what we need to do to move forward to ensure that all of us are going to be safer in a world of threats that know no borders. Central to this effort, of course, is strengthening the World Health Organization, the world's leading and most vital public health international agency. Today, I'm really delighted to have two global experts, two former leaders within the WHO who are going to share their views on some central key points on what we all need to take back to our countries in terms of asserting and how we can strengthen this vital organization. First up will be Dr. Ala Alwan. Dr. Alwan is the former Assistant Director General and Regional Director of the WHO. He is a former Minister of Health for Iraq. He is also the Principal Investigator for the Disease Control Priorities, and he's coming to us from London. Following that will be Dr. Marie-Paul Keeney. Dr. Keeney is the former Assistant Director General of the WHO for Health Systems, Innovation, and Director of Research, and she is based in Geneva, and she's the Innovation Director head at INSERM, which is based in France. After the presentations, we'll have a discussion, then we'll turn it over to you for questions and answers, so please make sure you put your questions into the question box. So first, I'd like to turn it over to Dr. Alwan. Dr. Alwan, welcome and thank you for being here today. Over to you, sir.
Thank you very much, Keith, and thank you for inviting me to this panel. This topic, the topic of the webinar, is very important to me. I have spent a major part of my career working for WHO. And I've also had experience working closely with WHO at the country level in different capacities, including as Minister of Health and Environment. So as a WHO official for almost 23, 24 years, you actually get to know WHO from the inside, both in terms of strengths and also in terms of potential weaknesses. And at the national level, as a government official, you experience WHO from the outside, both when it supports your work and also when you find that such support is not strong enough. But in all cases, the assessment is that WHO is, as you mentioned, a vital organization, essential to global health, essential to countries. It is the directing and coordinating authority of international health work. So I do not think its mandate can be replaced by other options, and therefore I think that the sensible way forward is for the world to support the organization. Obviously, to objectively and openly assess the areas in the performance of WHO that needs strengthening and support in fulfilling its mandate as a strong and independent specialized agency. Now, having said this, there is absolutely no doubt that the organization today is facing a critical time, and there are important challenges that influence the way it functions and the way it fulfills its mandate. And let us be open and say that these challenges existed well before COVID-19, but they have become more exposed. They have become more serious by the pandemic. And as the independent panel on preparedness, pandemic preparedness and response stresses, I think the responsibility of addressing the challenges that are facing WHO for reforming WHO is with all countries. It's with all global health institutions, but obviously specifically with WHO Secretariat because of the central role and accountability of the organization in international health. And to be specific, if Jenna can maybe just show the slide, I think there are 3 or 4 overarching areas where serious challenges exist, and these require obviously urgent action. First, those that relate to the governance, and secondly, related to governance is the critical importance of protecting the independence of WHO. And thirdly, the way the organization is funded is an extremely important area for major reform. And fourthly, finally, we need to address the challenges that relate to the technical performance of the organization. And so let me start with governance and independence. These two are together because they are linked. And I think that strengthening the governance mechanisms of WHO is a priority. And the question, of course, is how do we reinforce the role of governing bodies of WHO and how to ensure the independence of the work that WHO does and the decisions that are made by the Secretariat and by the governing bodies. And for those who are not very familiar with WHO, the governing bodies of WHO are the World Health Assembly, that meets every year in May, and the Executive Board that meets twice a year. And these are composed of representatives of member states. They actually elect, they are responsible for electing the Director General, for electing the regional directors. They develop WHO policies, they monitor WHO's performance. So clearly, the way member states exercise their role in governing bodies meetings has a direct positive and unfortunately sometimes negative impact also on the performance of the organization. So when they take their role seriously with global health as the main motivation, away from their own political and self-interest, and when they objectively monitor the work of the organization or the Secretariat and address gaps, then WHO normally does very well. But when individual countries or individual interests of member states influence the work of WHO, then there is a major risk in compromising the work of the organization. And I think the same applies to other parties or other partners that may influence the position or work of the organization. Slide. So the central point that I really want to make here is that there is now consensus that WHO today needs stronger governance mechanisms. And this is the conclusion of the recent report of the independent panel for pandemic preparedness and response. And it's also actually consistent with the WHO constitution, which was written in 1948, which actually requires the member states to respect the exclusively international character of WHO leadership and not to seek to influence them. And the Constitution also requires WHO staff on their part not to accept and not to receive any kind of influence or instruction from any government or any authority external to the organization. And I think strict enforcement of this requirement is a prerequisite for reform. So if countries want to reform WHO, the first thing that they should agree to do is not to unjustifiably influence WHO's positions and decisions, and to avoid any pressure on staffing and HR decisions. I mentioned the independent panel because in its recent reports, there were important recommendations made. And one of them is the establishment of the Global Health Threats Council within the United Nations system. The idea is that such council would sustain and monitor country actions. It would coordinate the international system. The panel also recommends elevating global health emergencies and pandemics to the heads of state level, so moving it from the World Health Assembly to the General Assembly of the United Nations, and even considering some sort of an international legal instruments like a pandemic treaty, or some people are talking about a framework convention on pandemic preparedness and response. I personally think that these proposals can help, but they really need careful consideration and study, looking, of course, at the existing models. This is not the first time that a convention is established or a high-level meeting on health results in a political declaration. And because of the experience that we have, it is important to recognize that important difficulties are actually in the details of implementing these recommendations. It all depends also on how countries will comply with the outcome. People have been talking also about how the executive board of WHO can be more objective and have a stronger role in governing the organization. So one other potential action that may be considered is to introduce the rules of procedures of the executive board, maybe to introduce to these rules the importance of nominating members in their personal capacity. They have to be completely independent and should not be representing their own countries and their own countries' positions. After all, I mean, these executive board members are there to represent and protect global health. They're not there to present the position of their countries. So the central role is really to encourage or even compel the governing bodies of WHO to exercise a more serious role in monitoring and evaluating the technical and managerial performance of the organization. I want to move into the next challenge, which is funding. If Jenna could maybe move to the next slide, please. Yes. So funding is a major area for reform. And again, for those who are not very familiar with WHO, the way WHO is currently funded compromises its integrity. It also compromises its independence, because currently the assessed contributions that actually come from each member state every year, according to the GDP percentages, this is what we call the regular budget of WHO, which is the flexible part of the WHO budget. This constitutes only less than 20% of the overall budget of WHO. And the major part of the budget, which is more than 80%, is actually provided as voluntary contributions by certain governments and maybe donors, some funding parties, who normally earmark the use of the funds they provide to their own priorities, and not necessarily to WHO's program priorities. And this obviously puts WHO at the mercy of a few donors who tend to influence the program budget and the work of the organization. And in over 25 years of working either in WHO or with WHO, there have been a number of attempts by countries to increase the flexible part of the budget to provide equitable funding to some highest priority programs that are currently receiving very little funding. And an example is the health system strengthening, the universal health coverage programs, the non-communicable diseases, and others. But unfortunately, these attempts have been repeatedly impeded by some countries. And this obviously has to change now. I mean, people are now recognizing the critical importance of funding in the reform process. And so there are three ways forward for this. One is to see a significant increase in the assessed contribution part of the budget, which is the regular budget or the flexible budget of WHO. And hopefully, and ideally, it should be more than 50%. And the second approach would be for countries that are actually providing voluntary contributions to provide more flexible funds and reduce earmarking to their specific priorities. And the third way of getting some important resources to WHO and to the budget is to consider more effective ways of financing the emergency program. There are a number of models, which includes, of course, what other agencies that the Global Fund and Gavi do, replenishment programs and so on, that may have to be considered by WHO and the governing bodies. Now, let me move into the fourth area of reform. I feel very strongly about this because I think it's an extremely important component of the reform process, and this is the technical performance of WHO as a specialized agency of the United Nations system, and the capacity of WHO to provide in an effective way its two key functions. These are the two essential functions of WHO. One is to develop norms and standards, and the second is the technical collaboration with countries. Both of them are equally essential, and they should be provided at the highest standards. And there are really two prerequisites or requirements for a specialized agency to assert authority. One is to achieve and sustain a very high level of technical competence, and the second is to be able to resist political pressures and influences, which I have mentioned before. And I think one of the most critical challenges to any WHO leadership is on managing to achieve the technical excellence of the organization and a high level of performance. And obviously equally important for the governing bodies to monitor and evaluate the performance of the Secretariat. Now, the fact is that today there is an increasing number of global health institutions and NGOs working in global health. But that should not mean that they are capable of taking over some of the core technical functions of WHO. I hear some, people talking about this. I think this is a serious misconception. WHO should work with them, of course, but international coordination on technical guidance and setting of standards remain critically important in many aspects of the technical work. So the key point here is for WHO to review and update its processes for selecting and recruiting staff, to consider innovative search and recruitment practices, and to drastically limit direct appointments. Appointment of staff in leadership positions is very critical and should really be subject to clear and robust procedures to ensure that those selected have the highest level of technical qualification and experience, and to avoid politically motivated or influenced appointments. And having worked in leadership positions in WHO, I am convinced that a more objective performance appraisal system is also key in improving the technical performance of the organization. So just two last points in my introductory remarks that I think are really worth mentioning as, let us say, interventions to support technical competence. One is WHO should also be using the convening power and the authority in a more effective way, particularly by identifying and working closely with leading scientific and academic institutions and centers of excellence in member states. This has to be used in a much more expanded way. And I'm not saying this kind of collaboration is not happening now. It is happening now, but over the last 2 decades, I have seen that the privilege of jointly working with international expertise is less used now than before, which I think is a huge opportunity lost. And the second point, and the final point, is really to obtain independent feedback from staff. And this has to come through objective and transparent staff surveys conducted through a governing body mechanism. It has to be independent. And there are, of course, effective models in other institutions than one can, review. But let me stop here, Keith, and thank you for asking me to make these remarks.
Thank you so much, Dr. Alwan. And then we're going to turn it over to Dr. Kini. Dr. Kini, please, over to you.
So thank you very much. It's a pleasure to be with you today, and it's a double pleasure because I'm sharing the stage with Ala Alwan, with whom I collaborated for many, many years when he was actually working in Geneva with me, and later when he was a regional director in Cairo. So always a great pleasure working with you, Ala. So I will cover briefly two elements on this discussion about reforms of the organization. One will be on data quality and transparency, and the second on emergency response. So what is my qualification to talk on data quality and transparency? Well, in WHO, I was Assistant Director General in Health Systems and Innovation, and data and health data were under my supervision, so in my mandate, and I have had many discussions about how we could help the organization perform better in this area. So what about emergency response? Well, I have had a role in the H1N1 influenza pandemic response through helping with the WHO initiative of distributing to 88 low and middle income countries 87 doses of pandemic influenza vaccine. And in particular, I have coordinated the WHO scientific and research response to the Ebola outbreak in West Africa in 2014-16. So although I have not been responsible for the emergency response itself, I have had many acquaintances and a lot of knowledge, understanding of the difficulty that the colleagues were facing in this emergency response. So first, about data quality of transparency. We are here currently, and nobody, I think, would deny that, in a time of data revolution. We see now that artificial intelligence and the way we use data is revolutionizing the information that we get, and also our capability to analyze this more accurately, and to, from this analysis of data, to define strategies and policy which are more adapted to real life. So, so in this regard, it is really a pity that, in spite of a lot of advocacy over many, many years, the capacity in most low and middle income countries for civil registration and vital statistic, which is the basis for collecting data at local level, at domestic, national level, on the health of the population, it is still missing. So what's needed? So clearly, and I'm sure Ala, we discussed it, is in agreement with them, it is imperative that there should be more investment to help this country acquire the capacity to run potent and effective health information systems. And this is within the capacity of WHO, but not only. Of course, WHO should not do it alone. Many actors are present on the ground, at all levels of the organization. Of course, the country, the regional offices and the headquarters of WHO, but also many NGOs, many other partners are there to help countries acquire this capacity. But this requires a lot of investment. Capacity building is very voracious in dollars or euro, whatever you use. So unfortunately, this area has been constantly underinvested and neglected. And if we want to have a system for data which is of quality and transparency, this is really a priority. So how did it work when I was at WHO? Well, this was a very how would I say, well-known and yearly executed system by which the WHO, the Secretariat, collected from countries health data, health information. Then there was a whole process of doing some modeling on comparing with the past data, comparing with similar countries. And at the end, through all this work, the department which was working on health information came with the official WHO statistics on health conditions in country by country. So this could be seen as a independent process, of course, but then was it really independent? So we have been highly criticized in WHO, saying, well, it's not independent because country can object. Of course, country could object. So, but the process that we had is that country before the health statistics were published, the country received in advance the data that the WHO intended to publish. Then they had a time to protest and to come with arguments. So if they came with arguments showing that indeed what we had not taken into consideration one factor or another, then these data could be corrected. But if they did not come with an argument that was making sense, then the publication of the data was nevertheless going forward. So I remember having had year after year the debates with quite often the same countries, because they didn't believe that the data of WHO accurately showed the reality at country level, but nevertheless these statistics remained. So what is happening now? In a movement which is, in my opinion, deleterious for the capacity of WHO to ensure data quality and transparency, the responsibility for the WHO health statistics have been passed to IHME, which is an NGO, a very intelligent and very effective NGO in Seattle, in the US. But they all these statistics are relying on modeling and estimates, and therefore it is very difficult both for the WHO Secretariat, which I think has even given up understanding the models, and for the countries themselves to understand how the figures were generated. So I think, unfortunately, in this area of independence, we now have a situation where countries have no recourse about what is published on their health statistic. And I would really think that we would go back, if possible, to an era where the objective is not to publish to a very sophisticated statistics based on estimates, but to help countries generate their own real data based on real fact and real mortality, real vital statistics. In the same area of data quality and transparency, I would like to approve really the stance of the current administration that WHO is a science-based organization. This was always the case, and certainly the nomination of the chief scientific officer, Dr. Soumya Swaminathan, is a good point. But the appointment of a chief scientific officer and even a scientific advisory committee is not sufficient. Indeed, no committee can handle all the areas of science that the organization has to cover. So it is very important, in my opinion. We had a lot of controversy when I was at WHO at that time. The then Director General complained that there were too many publications, peer-reviewed even by WHO staff. But I believe that if WHO needs to prove that it's a science-based organization, it needs also to be able to publish its conclusion, its methodology in peer-reviewed journals. So there has been a lot of efforts in the organization to strengthen the evidence base, which was published in WHO documents, starting with the guidelines. And for the Guidelines Review Committee, there is indeed a focus on meta-analysis, on grading, and this is very important when some of the guidelines become to be questioned by member states. Like I remember, for example, a question that was raised by one particular member state in a guideline on the setting up of a limit for sugar intake. So we can only, WHO can only maintain its position if it's fully based on science, if it's transparent, if it's published, reviewed by peers. So I fully, to finish on this area of data and transparency, I fully agree with the recommendation of IPPR that that independent data boards should be created at the global level, whose membership include representatives from national statistics offices. That these boards should be transparent, independent institutional boards that can review and validate the data. They should be independent from the Director General's office and report all their findings publicly. This is the only way to move towards transparency. I would also suggest that the role in WHO of the Technical Ombudsman Office should be reinforced, and by creating in particular a mechanism for reporting directly to the Executive Board and not through the Director General's office. So on my second point on emergency response, I certainly also concur with Ala that the creation of a Global Health Threat Council at head of state level, as recommended by the IPPR, will be important to bring the issues to the highest level of responsibility at country level. Because in many countries, in many places, the Ministries of Health are seen as weak, as poor, because actually they are the ones asking for money for health. They are not the one bringing money to the government. So if the issues remain at the level of Ministry of Health, they will not be taken for serious. To have, therefore, to bring this at the highest level of responsibility is certainly important. I also like Ala, you know, I'm doubtful about the role of high-level declaration. A declaration is a piece of paper, and if you want to ignore it, then after a while it just gets forgotten. So declaration, why not? It's the right movement, but it will not change the capacity of WHO to put an emergency response in place. So pandemic framework convention, yes, possibly, but I would have thought that a revision of the existing IHR 2015 framework or might help strengthen the authority of the DG to, for example, conduct independent inspection. But I would argue again that this should be only undertaken under the supervision of the Executive Board and shouldn't be a prerogative of the Director General himself. Certainly, what should be done also is to conduct periodic assessment of country preparedness based on regularly updated pandemic preparedness plan, as mentioned, and this remains very important. And to come back finally to the to what is proposed by the IPPR as a WHO mandate for emergencies. I agree also that normative policy and technical guidance should be within the mandate of WHO, and that WHO should be empowered to take a leading, convening and coordinating role in operation aspects in the emergency response to the pandemic, without indeed in most circumstances taking on responsibility for procurement and supplies, because this latter role would be better covered by other organizations and would diminish, I would say, the risk of corruption. Like, for example, as we've seen in some countries at the time of an emergency, the unfortunate use of many tens of liters of gasoline per kilometer of a four-wheel drive in countries. So I think that the role of WHO should be focused on what WHO is best at, and the rest should be covered by others. I've seen that in the IPPR there is also a recommendation that Act A should survive COVID-19. I have no position on that. I think that why not? Having some other organization succeed to Act A, but if Act A or a sort of Act A is to remain with us more permanently, I would argue that its governance should be completely redesigned, as for the time being, to say the least, the governance is unclear. So with these few remarks, I would like to stop to leave more time for question and answer and also for the discussion. Thank you very much.
Thank you very much, Dr. Kini. That was wonderful, and thank you again, Dr. Alwan. We've got a lot of questions coming in, but if I could just start for a moment on the Dr. Alwan on the governance issue. If you could bore down a little more deeply into the reform of the executive board, because that is fundamental to strengthening the independence of the WHO. What do you think the next steps are right now for member states to assert this at the World Health Assembly? What do they need to do to be able to strengthen the executive board at the Assembly?
Well, that's an important question, and I know that there have been some suggestions or recommendations to maybe make some changes to the way to the composition of or nomination of members of the executive board. There have been some suggestions that the members of the executive board should have some sort of a resident capacity in Geneva rather than just nominated by their own countries and then attend meetings twice a year in Geneva. And the idea behind this suggestion is that they would be much more involved in the work of the organization and in identifying and monitoring the performance of the organization. They should also have much more time, of course, dedicated to the organization instead of just traveling maybe 5 or 7 days every 6 months to Geneva. I think this may have some advantages, but at the same time, I really think that the key issue is that the members of the executive board are there to support the organization, to support the global health, and they should only represent the interest of global health and the interest of the organization. They're nominated by their countries, but they have to be nominated in an independent way. They should act independently rather than what we actually see in many cases, that members of the executive board are also concerned, with the positions that are taken by their own countries, by their own interest. So the independence of the executive board members, in my opinion, is more important than whether or not they are traveling to Geneva or they are resident in Geneva. Now, to make them some sort of spend much more time within the organization, to know the organization better, I think is very important. But more important than this is the independence of executive board members.
Don't you think that there could be actually two ways this executive board could function? You could have the session of executive board itself, where indeed, and we see, as we see also for the World Health Assembly, there is always, and I think it will be difficult to close this completely, some reliance about what's the interest of the country and what the country wants to push. But you could have also a different role of the executive board between the session, by which then this other role would be taken to support the organization. You could imagine, for example, that the ambassadors could serve as the surrogate executive board, a representative of the executive of the countries who are at that time in the executive board. They live in Geneva, most of them, not all. Some countries don't have ambassadors in Geneva, but then could be surrogates. And they live in Geneva, and they meet quite often, and they could play this role, which is less how do I say, influenced by the internal politics. What do you think?
Please, Dr. Alouane. Not sure if Dr.
Ala is trying to get his microphone.
Possibly. We'll wait until Jenna will help Dr. Alouane to get on his mic. But Dr. Kini, to you, well, we didn't discuss this very much, but about the regional offices. What is necessary to strengthen the independence of the regional offices and to protect them from political interference?
You know, there is one recommendation of the IPPR that Anwar hasn't commented on, which I really fully support, is that any elected officials, so this is the Director General, as well as the regional directors, could do a single mandate only. So why is that? It's because, you know, with these elected officials, when they are in place, there is unfortunately too much horse trading, about trading of position against votes. And if you could indeed agree that the mandate for this elected official would be a single mandate only, then you would, I think, by quite a lot, remove then the incentive that there might be at this level to please countries and to bow to their pressure in order to be re-elected. So this is and Ala, sorry that we've missed you for a minute. I wanted to say that you hadn't commented on this proposal on governance, and I was wondering what you think about now the two things that I've said. One is that the ambassadors should serve as an EB representative of the real EB, of the capitals, delegated by the capitals to serve as this supporting EB during the session, and also of the proposal that the elected official would only serve for one mandate, a prolonged mandate.
Sure. So these are two very important points, and I'm sorry I had a brief transmission problem. On the election of the Director General and the regional directors, I know that the independent panel has proposed one term instead of 2 terms, and I think it makes sense because they actually increase the term of the Director General and maybe also of the regional director from 5 years to 7 years. So if the election process is sound, and if the organization is fortunate to have the right Director General and the right regional director, then one term for 7 years, I think, makes a lot of sense. So the two key issues, how the election is taking place and how efficient the election process is in bringing the right person to manage the organization or the regional part of the organization, and the second thing is that the duration. So I think increasing it from 5 to 7 years, making it only one term, I think makes a lot of sense, provided, of course, that the process is successful in bringing the right person, the leader. That is one. On the second point, on the ambassador being a member of the executive board, the ambassador is a political position, and I remember I was very much involved in moving the non-communicable disease issue from the World Health Assembly to the General Assembly of the United Nations, and I had the privilege of getting some experience on how the discussions in the General Assembly of the United Nations are different from the discussions with ministers of health in the World Health Assembly in Geneva. And there's a very important difference in the way foreign policy people manage the same problems. And so one thing that I was surprised to see is that there were things that were ABCs agreed by all member states when they are discussed at the World Health Assembly. When they are discussed at the General Assembly, you can see the same country that was endorsing the principle or a position in Geneva is actually having a problem in endorsing it, because the people who are in charge of the discussion are different. And I remember also one of our colleagues from one of the important countries, low and middle income countries, coming to us and asking us or complaining that the Ministry of Foreign Affairs representatives in New York are not really taking into account the positions of the Ministry of Health. So I get worried sometimes. I get worried when, the foreign ministry people manage health issues, particularly in certain, health challenges. And so I don't know how an ambassador could be independent. I think the ambassador is more inclined to think of his own country's positions and his own country's interests than someone who was nominated mainly by the Ministry of Health to represent global health. So again, the issue of independence is, I think, something that worries me. I know that some of the ambassadors in Geneva are wonderful people. They have made breakthroughs in addressing global health challenges, but not all of them are like this.
Well, we want to get to some questions here. This is a very stimulating discussion. I'd like to take questions. I'm going to telescope a few of them. So from Jim Cleary and a few others. Jim wants to know about, and it gets to the technical issue that Ala and Marie-Paul, you both discussed. What is the status of the WHO collaborating centers? And I would add another part to this. How can the WHO strengthen its relationship with the national academies, which have such an incredible body of individuals that could help to strengthen the technical capacity within the WHO? What are your thoughts on that? And I'll start first with Marie-Paul and then Ala to you. Marie-Paul.
Well, in my time at WHO, I was responsible for the handling the collaborative how do we call them again? The collaborative centers, okay, of WHO. And I must say that it was really very varied. You had some area where the collaborative centers were very, very effective, like for flu, for example, and they were themselves in a network, and they were doing a lot of work for the WHO, especially in scientific area. And some others had been nominated long ago, and the difficulty is that we could not get rid of them, because as soon as we tried to get rid of them, then there was an ambassador calling and saying, or Ministry of Health saying, how you dare not keep our collaborative center. So I think, I don't know if this has changed. I don't think so for the time being, but I would say that it would be good to have that the time span of collaborative centers should be term limited, and that there should be an exception that they should be renewed over after a certain period of time. But they are very powerful allies in terms of bringing the best of science to WHO, to the Secretariat, where the WHO Secretariat doesn't have the time to follow so closely all the area. I remember in the area, for example, of neglected genetic diseases, we had no capacity in the Secretariat, but working with the collaborative centers allowed the Secretariat to understand what was the matter.
How do we, Paul's comments, how can we use it? Can we use the WHO collaborating centers more effectively? Can we do a better job of engaging with national academies and other scientific bodies around the world?
Yes, I think this is an excellent question. And one of my last two comments actually focused on this issue. When I was Assistant Director General, I conducted a review of collaborating centers. And I did the same thing when I was Regional Director. And the conclusion was the same. Many, if not most, of the collaborating centers that have been designated by WHO at the headquarters level and the regional level are currently inactive. I have to say this. I mean, this was, my conclusion when this assessment was made. And as I said, it's the same at the regional office level. Most of them are inactive, and those that were active were their contribution was limited. That does not mean that all of them are like that. There are some excellent WHO collaborating centers, but I would say that the number of those that are really meeting the terms of reference of designation is much less than the so many collaborating centers, as Mary Paul said, that are not really providing any contribution to their own countries or globally or regionally. So this is an area where a drastic review and a very serious review has to take place. And in my last comments, in my introductory remarks, I said that this is an area where WHO has to look at very carefully, because there are now so many global health institutions that have great capacities, innovation, scientific capabilities that would need to work closely with WHO. And so the responsibility now is to identify those institutions and centers of excellence in academia and even in NGOs, and try to get them engaged in the work of WHO. We could use, of course, the WHO collaborating center concept for this, but we could use other ways of developing these kinds of partnerships. As I said at the beginning, I mean, the number of global health institutions is increasing so quickly now, and many of them are doing great work. They will not replace WHO, but WHO should be much more active in getting to work with them based on the priorities of the organization.
So Ala, so Marie Paul is an extension of Ala's comments. It's got to it connects his assertions about strengthening the technical capacity of WHO and your important points about strengthening the capacity of countries to have better mortality, morbidity statistics, building up that capacity. How can the WHO, alone or in partnership, strengthen the capacity within ministries of health and other important ministries, particularly in low-income countries, to strengthen their public institutional capacity to be able to deliver the public goods their countries need? Because it's a big gap, we know, particularly in low-resource countries. Can the WHO play an interlocutor role in strengthening that capacity, particularly in low-income countries?
May I respond?
Go ahead, Ala.
Yeah. So this is another area that should receive a much higher priority within the organization: public health capacity and the essential public health functions. And when I was regional director, we developed a tool that would help us to assess the public health capacity and the essential public health functions in member states. The question that you raised, I think the answer to it, yes, absolutely. I think this is one of the most important functions of WHO. I said at the beginning, I mean, there are two basic functions. One is the normative functions of WHO, norms and standards, and another one is technical collaboration. I say this because I'm hearing now voices that say WHO should focus on norms and standards and let alone, I mean, let others to deal with technical collaboration with countries. And I definitely don't agree with this, because a lot of low and middle income countries rely on WHO in capacity building and rely on WHO in technical collaboration. The know-how of implementing the recommendations that WHO and other and academic institutions develop is critical for these countries. So how do you strengthen the essential public health functions? And when we use that tool to assess public health functions, essential public health functions and public health capacity, we found that one of the richest, if not the richest country in the group of countries that we looked at had actually major gaps or significant, let me be very accurate, significant gaps in basic public health functions. And so this is something that I think the World Health Organization has to give a much higher priority. I mentioned that health system is a low priority program in WHO. And now we have universal health coverage as a target for achievement by all countries in the world in 2030. And we know that less than half of the countries of the world are actually essential health services.
Yeah, no, thank you, Ala. And Marie-Paul, would you like to add some additional comments to Ala's?
Well, you know, I certainly agree that but strengthening capacity in countries is something which is essential, and the WHO cannot do it on its own. But it's good that WHO is a steerer, because actually you want also to facilitate this strengthening using how would I say, harmonized methods. You don't want to have one country to go this way and another one to go another way, so that there's no data compatibility. So I would really agree with Ala that WHO has a role in this area, and that the WHO should get the means to do that. I would also argue that there needs to be a domestic investment, because too often when we look at return to countries and say, you know, what are you willing to invest yourself to build this capacity and to maintain it? Too often there's only reliance on external money, on external aid. But WHO should have a role, and this should be one of the priority at the highest level of the heads of state, if they want to build a country which is resilient and for the next pandemic not to occur, because the handling of data is critical and should be supported at the highest level of government in all countries.
Thank you, Marie-Paul. I'm going to turn it over back to you in a minute, and then to Ala for some final comments. But I want to just read, because we had so many excellent questions here. I'm just going to read some of the central questions out for the audience and for both of you to hear. A question was about what can, and please don't bother to respond. Question was about from Pinaki about how can autocratic communist countries be held accountable to the WHO when they're not listening to anybody. Another question regards a very good one from Chris, who would like to know whether the WHO should actually create a trusted internet domain for health information, particularly given the disinformation threats that we have worldwide in the anti-science movements. Additional questions regarded how people are selected to actually attend meetings at the WHO, and others are how to connect. A very important point from Julia is about most countries' ministries of health are poor, and the importance of connecting to ministries of finance who have control over the resources, a key point in bringing Ministries of Finance into the health discourse as we advocate for what is needed. Another from Jayakar wants to know about public-private partnerships and how they can be used in terms of strengthening technological capacity, and on it goes. We're getting to the top of the hour, and I just want to turn over first to you, Dr. Kini, for any final thoughts that you have, and then to Dr. Alwan for any final comments, and then I'll close. Dr. Kini, please, over to you.
Well, of course, there's no way to answer all these questions in 1 minute, but just, just a point. Health is political. I think this is clear. And for example, the previous Director General always said that, instituting universal health coverage is a political decision. It's not a technical decision. So health is political, but also WHO and the World Health Assembly and the Executive Board is a way to bring together countries which politically are completely opposite. I remember really a time that was sort of really fantastic, where there was the then representative of the US addressing the then representative of Iran, saying that I agree with our Iranian representative. And it's only on health that you can have this moment where actually, because of a public health, a public good for all countries, will bridge their differences and agree on moving forward on health. And this is really very precious. So in terms of a reform of WHO, yes, WHO is never perfect. No organization is perfect. But instead of always inventing another organization, say we need another one and not WHO, it's better to see what WHO is good at. Never should a good crisis be lost. WHO made a lot of progress after the Ebola crisis in terms of emergency response. It wasn't yet, of course, sized to respond to COVID, but progress has been made. Progress should continue to be made. So I really think, and I hope that countries will support WHO, support the reform to have a better organization, but without trying to replace it and to cut its mandate. That's my plea to the countries.
Thank you, Dr. Kini. It's a very powerful statement. Dr. Alwan, please, over to you.
Yes, so thank you, Keith. And there's so many interesting questions. I would love to continue the discussion, but specifically on the role of ministers of finance. We're currently working with some countries on universal health coverage and also on developing the essential package of health interventions for universal health coverage, and we're working, of course, on priority setting, on health benefit package setting. But the critical issue is to implement universal health coverage. There is absolutely no doubt that the Minister of Finance and the Minister of Planning in low and middle income countries are essential players. And not just in universal health coverage, in any priority program in global health, like immunization, communicable diseases, health, pandemic preparedness, emergency response. The role of the finance ministry and the planning ministry is absolutely essential. If we really want to move forward on these initiatives, the health has to move into a higher level of priority and discussion at the government. And that is why I think health diplomacy is going to be an extremely important area that should be given resources and priorities. So just wanted to highlight the importance of ministries of finance in this, which is very much a role that is very much underestimated. But basically, in 1 minute at the end, I really think that WHO has a great opportunity for reform today. It's a vital organization, as you described, Keith, at the beginning. It's essential, it's indispensable for global health and for countries. There are areas that really need strengthening in terms of governance, in terms of financing, in terms of performance, and also in terms of empowering the organization to address global health challenges. And I think the responsibility is, as we mentioned at the beginning, is with countries and also with the secretariats. But I think I stress on the role of member states as governing bodies of WHO, and I hope that the COVID crisis has, I think, convinced even heads of states and government that health security is an integral part of global security, and this is a huge opportunity for the health sector to reform and to address the challenges that we face. So thank you so much for giving us this opportunity, and I'm sorry we did not have time to have some more discussion or maybe answer some of the questions that you have in your list.
Well, I wanted to just list those out in respect to the audience who had so many wonderful questions. I think you both, Dr. Alwan and Dr. Kini, you gave a powerful presentations on trying to reform this key public health organization. Dr. Kini said we don't need to make a new WHO, we need to reform what we have. And Dr. Alwan, all a challenge in moving forward. The fact that the World Health Assembly is taking place right now is important because of the independent panel findings that just came out to show us what paths forward. Important because, as you mentioned, Dr. Alwan, that the World Health Organization is us. It's the member states that make it up. It's not some discombobulated structure. It is what we make it to be. So whether it's the governance, opportunities for reform, or technical capacity, or strengthening the funding so that 80% of the funding of the WHO is going to be not optional contributions, but an assessed contribution that gives the WHO the long-term financial budgetary stability so they can do the work that they need to do for all of us. And then finally, the data quality issues and strengthening national capacity, Dr. Kini, that you mentioned, all of what you both said. We personally hope at CUGH that the member states take to Geneva and assert those so that we will have a stronger WHO in the future. So thank you so much, Dr. Alwan. Thank you so much, Dr. Kini. Much thanks to Jenna Smith for producing this. And thank you for joining this CUGH webinar. It will be on our website a few days from now. Follow us on Twitter, share our work, share this webinar, and we will build a stronger future for all. Have a wonderful day, everybody.
Thank you.
Thank you.
Thank you.